Hi, everyone. Welcome back to Mad Barn Academy. And if you're new here, then welcome. We hope to earn your subscription today. I'm Dr. Fran Rowe, one of the veterinary nutritionists here at Mad Barn. With summer fully upon us, our nutrition team has seen a real uptick in diets mentioning seasonal allergies. So I thought it would be a great time to cover the most common type of allergy in horses, insect bite hypersensitivity, or IBH. So let's get started. Many of you might be familiar with sweet itch or summer itch as the name for this condition. Insect bite hypersensitivity is an allergic reaction to the saliva of midges, which are little tiny biting insects in the Culicoides family. In affected horses, these bites result in very, very intense itching, so much so that horses will obsessively rub, they'll scratch, and they'll even bite at themselves for relief. It's not uncommon to see the severity of IBH progress year to year as horses become even more sensitive with repeat exposure. And it's thought that around 10% of horses worldwide are affected by IBH. So, what exactly is a hypersensitivity reaction? Well, let's back up just a little bit and review what the role of the immune system is. The whole purpose of the immune system is to identify something foreign called an antigen that could do our body harm and destroy it. Dangerous pathogens like bacteria, viruses, parasites, these are all types of foreign invaders that the immune system protects us from every day. Sometimes, however, our immune system gets a bit overzealous and reacts to non-dangerous antigens, things like pollen or food proteins or medications, and we develop an allergy. Alternatively, our immune system can accidentally mistake our own cells as dangerous antigens, triggering what we would call an autoimmune type reaction. Ultimately, hypersensitivity reactions describe immune responses that are inappropriate or exaggerated. Essentially, our immune system goes way overboard or it gets it wrong and ultimately causes our own self, our own body harm by way of inflammation, cell damage, etc. So there are four types of hypersensitivity reactions. The first is type 1 or immediate hypersensitivity reactions. This is when an antigen triggers a rapid release of histamine and other inflammatory mediators from immune cells. This results in localized swelling, redness, itching. Think, your classic mosquito bite on your skin. In extreme cases, it can cause a whole body inflammatory response, leading to respiratory distress or something that's as severe as anaphylaxis. So, good examples in both people and horses include insect bite hypersensitivity, conditions like asthma, atopy, and anaphylaxis. Type 2 hypersensitivity reactions are cytotoxic reactions in which the immune system attacks cells in our own body by mistake and destroys those cells. In humans, two good examples are Graves' disease or myasthenia gravis. In horses, examples include neonatal isoerythrolysis and IMHA. Type 3 reactions are immune complex mediated hypersensitivity reactions in which antigen antibody complexes form and deposit in tissues. This results in inflammation and damage to those affected tissues because those complexes aren't supposed to be there. Two classic examples in humans you might be familiar with are something like rheumatoid arthritis or lupus. In horses, examples include purpura hemorrhagica, which is a complication of strep equi or strangles infection, and recurrent uveitis. Last on our list are type 4 reactions, which are delayed hypersensitivity reactions. And these reactions typically occur like 2 to 3 days after the initial exposure. So contact dermatitis is a really good example of this, both in humans and in animals, such as people allergic to poison ivy or those who have a latex allergy. So, as I mentioned a few slides ago, insect bite hypersensitivity develops when the immune system reacts inappropriately to the saliva of biting midges, right? That saliva is not a harmful antigen, but it still triggers that really exaggerated or extreme immune response in the body. So, midges are blood feeding insects that come out during warmer weather. It's the females that bite, not the males. And it's most common to have midges swarm in low light conditions. So, think dawn and dusk. And while any part of the body can be bitten, of course, midges tend to bite most along the belly or the ventrum, the tailhead, or kind of along the neck or in the mane. And basically, these are areas that the horse can't easily access, like with their mouth, to knock insects off, or with their tail by swishing their tail and getting the insects off. So midges are found worldwide in a variety of climates. I know a lot of people tend to think that our kind of biting nuisance insects are more of a, tropical or subtropical type climate, but really midges are quite ubiquitous. They've been documented in a variety of climates, desert climates, high elevation, cold climates. So there are really a variety of these species all over. So, where these insects prefer to breed is in kind of damp conditions. So, they're going to look for environments that have a little bit of standing water or rotting vegetation, like wetlands or marshy areas, or anywhere where there's kind of composting vegetation or manure. It's thought that about 10% of horses worldwide are affected by IBH. And why some horses develop this condition while others do not is thought to be related to several sort of interconnected factors: exposure, genetic susceptibility, concurrent disease, and environment. So, environment might seem obvious. Horses that live in a really high burden area where there's a lot of these biting midges, and so they're getting exposed more often to the saliva, maybe more likely to develop this sensitivity at some point in their life. Exposure is another big one. It is thought that foals that are exposed to midges or the saliva of these midges early in life are less likely to develop IBH, because as their immune system is developing and as a young animal, that initial exposure really teaches the immune system that this is not an issue, versus there's been, a couple studies looking at kind of relocation of naive horses, naive meaning horses that have really never been exposed to midges, relocating those horses to endemic areas where midges exist, and those horses may be at a increased risk for developing IBH at some point in their lifetime. Certainly, genetics plays a big role in the development of insect bite hypersensitivity and other allergies. There is evidence of heritability for IBH. So, foals born to dams or have grand dams in their lineage that were affected by IBH may be more likely to develop it in their lifetime. And then thinking about concurrent disease. So, one of the big ones to think about is horses with asthma appear to be more likely to be affected by IBH and vice versa. So, horses with IBH may be more likely to develop asthma. And we know that asthma and IBH fall under that type 1 hypersensitivity reaction category. So, these are sort of similar immune conditions from that perspective. So identifying IBH is generally pretty easy, especially in these more severely affected horses. So these horses will obsessively scratch and bite at the affected areas that where they have these little buggy bites. And the itching can be so severe in some cases that these horses will even begin to self-traumatize by, breaking the skin open and causing wounds. So these horses may also appear really agitated. They might be restless. They might be looking for really creative ways to itch, especially if they're trying to get their belly or between their hind legs, or the top of their neck on their poll. They can get pretty determined to seek relief for those really itchy areas. So it's most common to see these bites along the ventrum. So anywhere between the front legs, down the belly, around the udder or the sheath, and then into kind of the groin between the hind legs, at the tail head, and then on the neck or kind of in the mane. So these lesions will vary in severity depending on how itchy they are and how much that horse is really scratching and rubbing at them, but will usually display some degree of hair loss, kind of raw skin, maybe even bleeding skin if they've really been traumatizing the area, weeping, thickened skin, scabs, crusts, and then even some hives across the body as well. It's also common for secondary bacterial infections to be present due to that chronic self-trauma from scratching and biting. So if you have a bug bite area that's gotten kind of infected, you're going to see, more swelling, heat, redness, and maybe even some like pus or purulent discharge. So these pictures on the right kind of illustrate the range in dermatologic signs depending on how severe that horse's allergy might be. So the diagnosis of IBH is most often made presumptively, meaning we're able to kind of put a couple puzzle pieces together on how that horse is presenting and kind of come up with the logical diagnosis of IBH. So we'll be looking at things like, the horse's history, the seasonality and distribution of lesions, and confirming that that horse does indeed live in an environment conducive to midges. For a more definitive diagnosis, you can pursue allergy testing. There are two forms of allergy testing available in horses. There's intradermal testing, which is testing through the skin, and then there's serum testing or taking a blood sample. So the pictures on the right illustrate intradermal allergy testing, where the vet is going to basically create a grid on the horse's neck or on their shoulder, and then they're going to inject allergens at set little points and keep track of your grid so you know what you have. And then you're going to look at the reaction. And so in that second picture on the bottom there, you can see all those little bubbles where different allergens have been injected under the skin, and you're going to be looking at like the degree of that horse's reaction to that allergen. And one of those allergens can be biting midge saliva. So sometimes combining both types of allergy testing can help rule out false positive or false negative results and establish a more accurate diagnosis, especially if there's a question about whether a horse is truly affected or not. Maybe they have a little bit more mild disease, or the distribution of their lesions isn't quite as textbook as we expect. Unfortunately, IVH is not a curable condition. The best we can do is implement management strategies to limit exposure, control any itching if the horse does get a bite or two, and support a healthy immune system. So let's dive into these three categories in a bit more detail. So first, here are a few key ways we can help limit a horse's exposure to these biting insects. Thinking about some environmental changes, so stabling horses during dawn and dusk hours when we know those midges are going to be out swarming. Using fans and high-powered fans to keep midges from landing on the skin, and then removing access to suitable Culicoides habitats. So, stabling those horses away from marshy wetland or anywhere where there's kind of standing water, being really good about manure management and any kind of compost or rotting debris in that horse's environment. And then also we can use things like physical barriers to deny the midges access to the skin. So sometimes these horses end up fully suited up, ear to hoof, with some sort of fly gear. So using fly sheets, masks, leg covers, full belly guards, etc., can be really successful in keeping these midges off the skin and from biting. And then of course using our various insect repellents, to act as a chemical barrier there. So our next management strategy is to control that pruritus or control that itching that will occur if the horse does still come into contact with midges. So this type of control is usually going to come with the help of your veterinarian. So one of the most common drugs used to control IBH symptoms are steroids. They're very powerful anti-itch and anti-inflammatory medications. Other medications and topical type products may be indicated depending on how severely affected the horse is or if any secondary infections are present. But things like antihistamine, other anti-inflammatories, antibiotics, and then like topical shampoos and salves. There's also the possibility of pursuing immunotherapy for your IBH horse. You might be more familiar with this being called allergy shots in people. This process involves desensitizing the immune system to a particular allergen through repeat controlled exposure. If your horse is amenable to needles, this is a process that you can actually do at home. So it requires a small, usually subcutaneous or just under the skin, injection repeated on a very regular schedule. Many horses respond favorably to allergen-specific immunotherapy, with horses generally showing better control year 2 of their shots. So it's important to note that this strategy is a long-term one, and meaning that it's going to require several years to kind of reap the benefits and may be required for the life of the horse. So last on our list is supporting a healthy immune response through nutrition. Both omega-3 fatty acids and spirulina have been shown to aid in the control of seasonal allergies in horses, including insect bite hypersensitivity. So omega-3s like DHA and EPA support normal regulation of inflammatory pathways and can really support a healthy oil production in the skin. And then spirulina can help support healthy regulation of allergy responses and inflammation. So some horses, might respond to one or the other, or some horses might respond well to a combination of both. Nutritional management can certainly add a layer of support, but it might not be enough to completely replace our need for medication or immunotherapy. All right, you guys, here are our references for today. And thank you so much for listening. Don't forget to like and subscribe, and be sure to check out the other videos on our channel. Additionally, I've included some of these links that you see here in the description of this video below. So if you want to learn a bit more about IBH, specifically, we have a great article on that, but I've also included some other of our articles on different dermatological conditions and allergies and other skin diseases, since sometimes these different diseases or conditions can all kind of look the same on the skin, so differentiating between them can be tricky. So all right, you guys, well, appreciate it, and until next time.